Hi everyone, my name is Lisa and I'm the founder and CEO of Astrid, and we're Australia's first female-led dispensary and clinic specialising in medicinal cannabis. Today I'm here to talk to you about endometriosis and pelvic pain and the role of medicinal cannabis in treating endometriosis in pelvic pain. Just a disclaimer that this presentation is for general advice only, and any medical advice should be consulted with your health professional or other health professional. So a little bit about me. My name is Lisa, as mentioned before, and I run a dispensary and clinic based in Melbourne and Byron Bay. And what we do is we have a team of pharmacists and doctors and nurses that specialize in medicinal cannabis. I've been doing this for a very long time. I've been in the medicinal cannabis space for almost 10 years now, and I founded Astrid in 2020 with the vision to really create a space that nurtured patients and allowed patients to come in to understand cannabis. I recognized a gap for a space that didn't really feel like a pharmacy, but felt more like a day spa, felt like a cross between going to a bathhouse and an ESOP. And so in 2020, I built my very first dispensary based in South Yarra, Melbourne, with very green walls, terrazzo stone, wooden shelves, and I filled the space with just products and medicines that are made from nature. So that could be supplements. We use a lot of nutraceuticals, but we primarily specialize in cannabis therapies. And what we do is that we actually have a team of doctors and nurses that specialize in understanding THC and CBD. And these are cannabinoids that are based in the cannabis plant. And similarly, we also have a team of pharmacists and technicians who also specialize in dispensing these medications to patients and educating patients on how to use these medicines safely. So 3 tips from me is firstly, if you are suffering from endometriosis, the first thing I would do is surround yourself with the right medical team that's fit for you. And what I mean by that is that we have a lot of patients coming in, and a lot of patients tell us that um, discovering Astrid has been a really long road for them because they've been through GPs and specialists and gynecologists and fertility specialists. And by the time they realized that medicinal cannabis or alternative therapies was an option, it's been, 5 or 6 year journey. And so my first tip is, healthcare professionals are there for you, and you do have a choice to choose the right team to surround you. So what that means is being comfortable with your GP, being comfortable and confident in your gynecologist, being confident in your medicinal cannabis specialist, and making sure that everyone's aligned in making sure that they are making the right treatment plan for you. That's tip number 1. Tip number 2 is understanding that alternative or natural health therapies is also an option for endometriosis. Now, I hear this a lot in clinical practice where we have patients coming through who have gone through multiple surgeries, so many different rounds of hormonal kind of therapies and treatments. And sometimes it works, sometimes it doesn't work. But a lot of the times, a lot of these medications come with a lot of side effects and a lot of risks. And cannabis therapies is a natural form of treatment. It doesn't mean that it doesn't have side effects, but it does have a lower side effect profile compared to traditional medications. So one of the reasons why it's special, I think, is because cannabis is a multi-symptom medicine, and cannabis is also a plant. And so what that means is that cannabis has an ability to target a range of receptors within our bodies. And particularly when we're looking at endometriosis, the receptors that we are feeling when we have symptoms from our endo is all over our body. It could mean that we are suffering from pelvic pain. It could mean we're suffering from muscle aches. It could mean things like anxiety or stress or lack of sleep. And in the traditional medicine world, there isn't really a one size fits all medicine that treats everything. But cannabis could be that option in that one molecule of cannabis can target multiple receptors within our own bodies. And the reason for that is because we are all, as human beings, born with something called the endocannabinoid system. And this is something, even for me as a pharmacist, was not really taught in pharmacy school or medical school. It's a system that is similar to like a respiratory system or a cardiovascular system, where there is endo, meaning inside our bodies, and receptors, meaning little things flying around our bodies where medicine's actually attached to. And cannabis actually attaches to a lot of those receptors all around our bodies. So we are born with an endocannabinoid system, and cannabis actually attaches directly into the endocannabinoid system. And so, as a patient with endometriosis, if I have anxiety or pain and pelvic pain or sleep issues, one type of cannabis can target all receptors, which is pretty amazing. And there's no other kind of treatment out there that has the same ability to have a multi-symptom effect like cannabis. So that's tip number 2, understanding that cannabis and natural therapies is an option, and then understanding that it is a multi-symptom medicine working on a naturally occurring endocannabinoid system inside our human bodies. Number 3 is very, very important. And I think that understanding that everyone's bodies is very unique, and everyone's different types of endo is also very unique as well. We have a lot of different types of patients coming into our clinic and our dispensary, and everyone's journey is really, really different. And the beauty of working with a more personalized clinic or dispensary that understands cannabis is that we know that cannabis is very unique and it works differently on everyone. And we know that everyone is on a different stage of their journey in their endometriosis treatment journey as well. And so for us, it's important to remind patients that we want you to find a cannabis formulation that works for yourself. An example would be, there's 2 types of cannabis. There's fast acting and long acting. And so a patient that has really, really sharp pain and pain that has a quick onset really wants a medication or a cannabis treatment that is fast acting. We have those types of medicines, and they are usually in forms of vaporizers or cannabis flower, which are inhaled, and they work very, very quickly, but they also leave your body very quickly. But we also have patients who suffer from endo, but they work throughout the day and they kind of have like a dull pain all day. And so those kind of patients require medications or cannabis therapies that are more long acting. And again, we also have that kind of cannabis as well. So there is cannabis medicines or formulations that are in gummy form, which are kind of like little, I guess, lollies in a bag. But you can put one in your handbag, pop it in the morning before you go to work, and it usually lasts between 6 to 8 hours, which is really, really great as well. There's also oil formulations as well, which comes in a little bottle with a little syringe, pop it under your tongue, and that also lasts for 6 to 8 hours as well. So tip number 3 is understanding that your body is also very unique. Cannabis can work with your body as well, according to how we need to personalize it for you. And understanding the way that it works is that there's different types of formulations: fast acting, long acting, different types of flavors, different types of targets as well, depending on what you need for your symptoms. So those are my 3 tips for managing endo with medicinal cannabis.